Okay, so we'll start standing or seated, your choice. Take your right arm with your elbow bent close in front of your ribs. So we're here at a 90, we're not back here. And then with your palm facing up, we're going to extend your hands so your fingertips are facing the floor. Take your other hand with your pinky finger, pull and press down and slightly back. You are trying to get a stretch in the hand and the forearm, all right? You're in control, so you can even wiggle the finger around a little bit just to loosen up the joint. We'll take it to the next finger, the middle finger, and the index finger. We're just going to do the 4 fingers, flip the palm, go into flexion. So again, the fingertips are facing the floor. You can start with the pinky or whichever, and we're aiming toward the middle of the forearm, past the wrist, so that you can feel the stretch across the forearm. Spend about 3 seconds or so on each finger, and you'll do that on both hands. Now the next part is for the thumb, and so the thumb comes all the way around here. So what we want to do is, starting with the hand, the other hand is going to encapsulate the whole joint. So this is my middle index finger, ring finger, is all the way down toward my wrist. The heel of the hand wraps around the thumb meat, and I'm going to encapsulate it, give it a hug, hold it as I pull my hand down slightly to give some traction, and then simply circumduct. I can either circumduct the thumb or I can circumduct the hand. And all I'm trying to do is get a little bit of freedom here in the joint. So once you've done that with one hand, go and do the other hand. Now I'm just gonna kind of revisit the other ones that the PT gave you, Nancy. So if my hand is like this, the PT wants you going back and forth, or the surgeon does. So what I'm gonna do is take my hand right here on the top of the forearm, so I'm right here, elbows bent, relaxing the shoulders, encapsulate the forearm, and then I'm just going to roll my bone in and roll the bone out. Roll it in. Now I'm not moving my upper arm at all. I'm just moving my forearm. So do that a few times. Trying to keep my elbow. It's going to go out a little, but just try not to move it much. All right, I'll do the same thing with the palm facing up, back and forth. And then when I'm here, I'm actually going to reverse it. So as my fingers go in, I'm going to roll the bone out. And as my fingers go outward, I'm going to roll the bone in. So again, what we're doing is freeing up. It's not really hard, but I've got a good amount of pressure. And I'm starting at the elbow side, middle, and back. And I'm making that hug on the forearm. The final one, so we did flexion, extension, eversion, inversion, and then supination, pronation. And this is the one we've done before at the bicep. We're going to do it here. So we place our hand just in front of the elbow, palm up, and then I want to hug hard, not hard, but firmly. So I'm giving it a good firm as I rotate my whole lower arm in and out with that flexion, with that pronation, supination. And then I'll do that all the way down toward the wrist. I can even go here on the thumb side if I want to, and just hold my hand still as the bones move underneath. And then I'll do it with the palm down, same thing. About 2 or 3 or so. Numbers are arbitrary, but that should really free up and help with the neuropathy and the numbness and tingling after your surgery. So let me know if you have any questions, but I think this is going to help you until I see you next.